Hi, this is Dr. Susan Brown, medical anthropologist and nutritionist. Today I'd like to share some tips for protecting bone health during perimenopause. Perimenopause designates the first few years before the last menstrual period. Frequently, more bone is lost during the first few years before the last menstrual period than in the first few years after the last menstrual period. Perimenopause is an important time to take action to protect bone. So my tip number one, correct symptoms of a difficult menopausal transition. Perhaps 25% of all women in the US and Canada experience a symptom-laden transition to menopause. If you're experiencing a symptom-laden and difficult transition into menopause, it is wise to make appropriate nutrition and lifestyle changes and also seek the aid of a holistic health practitioner if necessary. Women who have a more difficult menopausal transition, those who have more hot flashes and menopausal symptoms, are likely to lose more bone during this transition. Nutritionists, homeopath, practitioners of Oriental medicine, and holistic nurses and physicians can help rebalance the body with natural approaches and remedies. My tip number two is strive for nutritional excellence. Redouble your efforts to maintain an alkaline diet and provide yourself with all the 20 key nutrients needed to maintain bone. An alkaline diet is characterized by at least 2 cups of vegetables for lunch and dinner and a reduction in acid-forming foods. This is a cornerstone for protecting bone during the menopausal transition. There are at least 20 key nutrients essential for bone. The best way to guarantee adequacy of all these nutrients is to combine an alkaline diet with a high-quality multivitamin mineral omega-3 fat supplement. On my website, betterbones.com, I list these nutrients and give suggested doses of the key bone nutrients such as calcium, magnesium, vitamin D, vitamin K, and strontium. Vitamin K is of special importance during the menopausal transition. As the metabolism of vitamin K changes at menopause, and studies show that higher vitamin K status in midlife is associated with better bone mineral density. The end result is that women who have a higher need for vitamin K in perimenopause. Vitamin K2, in the form of MK7, is the best form of vitamin K for maintaining bone strength and also preventing calcification of the arteries. Tip number 3, exercise with an eye towards reducing stress. We know that strength training and muscle building exercises during perimenopause can help reduce bone loss. This is important, but equally important is stress reduction. So try to choose exercises that actually help you establish a higher level of emotional balance and happiness. Exercises such as yoga, Tai Chi, Qigong, and dance are all great ways to enhance emotional balance while also building bone strength. These are especially important during this time of change. Thanks for listening. This is Dr. Susan Brown, Director of the Center for Better Bones, wishing you lifelong healthy bones.